Welcome to the Deep Dive today.
Yeah.
We're going deep on a topic that I think touches everyone's lives in some way, and that is cancer. We've got a whole stack of research articles here.
Right.
And our goal really is to give you a clearer understanding of what cancer is, what causes it, and what's being done about it, both in terms of treatment and prevention.
Yes.
We're not going to sugarcoat anything, but we're also not going to, go all doom and gloom.
Yeah, no doom and gloom here.
The idea is to give you solid info so you can feel empowered, not overwhelmed.
That's a great way to put it.
Mm-hmm.
And I think what's really fascinating is how much cancer research has just exploded in recent years.
Yeah.
We've moved beyond just this monolithic view of like cancer as one disease,
right,
and recognizing its incredible complexity.
That's where it gets really interesting for me, because if every cancer is so different,
right,
how do we even begin to grasp what it is at its core?
That's the million-dollar question. I think at the very base level, it really comes down to cells gone rogue. Our bodies are constantly making new cells.
Right.
It's this tightly controlled process, but sometimes those instructions get scrambled. And these typos in the DNA are what we call mutations.
So it's like the cell's off switch is broken.
Exactly. And without that off switch, they just keep multiplying, forming a tumor. Now, not all tumors are cancerous.
Right.
Some are benign, kind of like a well-contained room in our body's house. But cancerous tumors, those are the ones that can break through walls and even spread to other rooms. And that's what we call metastasis.
Yeah, that paints a pretty intense picture. How common is metastasis? And what are the implications when it comes to treatment?
It varies widely, depending on the type of cancer and how early it's caught. But the fact that it can happen is why early detection is so crucial.
Okay, so we know these mutations are the root of the problem, but what actually causes them in the first place?
Right.
Is it all just bad luck?
Well, some mutations are spontaneous, just part of the wear and tear on our DNA as we age. But many are triggered by things we encounter in our lives.
Okay.
We often hear about smoking and lung cancer.
Right.
But there's a whole spectrum of things that can cause these mutations. Things like UV radiation from the sun, certain chemicals, even some viruses and bacteria.
Okay, so that's a well-known risk factor, smoking. But are there any lesser-known lifestyle choices that can significantly impact our risk?
Diet plays a huge, eerie role. You wouldn't believe the statistics on how much processed foods and lack of fiber contribute to certain cancers. Then there's alcohol, lack of exercise. It all adds up.
So it's this combination of our genes and our environment.
It is a combination. You got it.
It determines our risk.
Absolutely. And the more we understand about both sides of that equation, the better we can tailor prevention strategies. But here's something that I think most people don't realize. Even infections can increase your risk.
Really?
Yeah.
How is that possible?
Yeah. We'll take the human papillomavirus, or HPV. It's incredibly common.
Yeah.
And certain strains can actually disrupt cell processes, increasing the risk of cervical cancer. Thankfully, we have a vaccine for that now. Similarly, there are bacteria linked to stomach cancer and viruses that can cause liver cancer.
It's amazing how interconnected everything is.
It is.
So we've talked about what cancer is at a cellular level.
Yeah.
And the factors that can trigger it.
Right.
But I keep hearing about different types of cancer. It's not all the same, right?
You're absolutely right. The term cancer is really just this umbrella term. Imagine it's like a diverse city with different neighborhoods representing the various types.
Okay, I like where this is going. Give me a tour of this cancer city.
All right, so the biggest neighborhood by far is what we'll call carcinomaville. These cancers arise from epithelial cells, which line the surfaces of our organs and glands.
Okay.
Think lung, breast, colon, prostate cancer. These are all residents of carcinomaville.
So if you imagine our organs like rooms in a house, carcinomas are like wallpaper gone wild.
That's a great way to put it. And across the river, you've got sarcoma town. These cancers develop in the body's connective tissues, bones, muscles, cartilage. It's the framework of our house, the support system.
And what about the more, shall we say, unique districts of this city?
You're talking about places like leukemia land. This is where things get a little more fluid, literally. Leukemias involve the overproduction of abnormal white blood cells, disrupting the harmony of our blood.
So it's like the blood symphony is thrown off key.
I like that.
So we've got these different types of cancer, each behaving in its own way.
Right.
But how do we even begin to spot them? What are the signs?
That's the key question.
We should be paying attention.
Early detection is key. And that's where knowing your body comes in. While symptoms can vary wildly, there are some general red flags, unexplained weight loss, persistent fatigue, fever that hangs around for no reason, unusual pain. These are your body's smoke signals, telling you something might be off.
But sometimes those signals can be pretty subtle. Are there any symptoms that are more like a siren, specific to certain types of cancer?
Absolutely. Blood in your stool, for example, could be a sign of colorectal cancer.
Okay.
Difficulty swallowing might indicate esophageal cancer. Shortness of breath could point to lung cancer. It's all about noticing what's different for you and not ignoring those subtle shifts.
Okay, so it's about knowing our bodies and noticing anything that seems off.
Yeah.
But what about this idea of cancer stages? What does that even mean? Is it like levels in a video game?
You got it. Staging helps doctors classify how far a cancer has spread. Stage 0 means it's like a tiny seed, still confined to its original spot. Stage 1 is a small sprout, still localized. As the stages climb, the cancer gets bigger, maybe spreads to nearby lymph nodes.
And stage 4 is the most advanced.
Exactly. That means the cancer has metastasized, sending out those seeds to other organs. Staging helps determine the best course of treatment and predict the likely outcome or prognosis.
So let's say someone suspects they might have cancer. How is it actually diagnosed? It sounds like detective work, piecing together clues.
You hit the nail on the head. We start with imaging, like X-rays, CT scans, MRI. These are like our crime scene photos, helping us see inside the body without surgery. But to confirm the diagnosis, we need a biopsy.
Ah, the crucial evidence.
Exactly.
Tell me more.
It's like taking a sample from the crime scene, a tiny piece of tissue from the suspicious area. We examine it under a microscope to see if the cells are cancerous, and if so, what type. Blood tests also play a role, measuring tumor markers that some cancers release. And increasingly, genetic testing helps us identify the specific mutations driving a tumor.
This is where personalized medicine comes in, right?
Precisely. Understanding the genetic makeup of a tumor helps us tailor treatment to target those vulnerabilities. It's like crafting a custom-made weapon to fight that specific enemy.
So we've talked about the causes, the different types, the symptoms, and how it's diagnosed.
Right.
But what about treatment? What are the options?
That's the next big question.
And how do doctors decide which approach is best?
Treatment for cancer is incredibly personalized, depending on the type of cancer at stage.
Yeah.
Your overall health, even your preferences. It's like having a toolbox filled with different instruments, each designed for a specific job.
Okay, I like that analogy. What are some of the tools in this cancer-fighting toolbox?
For surgery is often our first line of defense.
Yeah.
Especially for localized cancers. It's like going in and carefully removing the weed before it can spread its seeds. Radiation therapy is another tool, using high-energy rays to target and kill cancer cells. Imagine it like a laser beam zeroing in on the enemy.
So we've got the surgical scalpel and the laser beam. What else?
Then there's chemotherapy, a powerful weapon that uses drugs to kill rapidly dividing cells throughout the body. Think of it like a systemic attack, targeting those rogue cells wherever they may be hiding.
This is the big gun. But I've heard it can have some pretty nasty side effects. Is that because it also affects healthy cells?
Exactly. That's why we're always looking for more precise and less invasive options. That's where things like immunotherapy come in. It's about boosting your body's own defenses to fight the cancer, like training your immune system to recognize and destroy the enemy.
That's incredible.
It is.
What other new approaches are there?
Another exciting development is targeted therapy, which uses drugs that zero in on the specific genetic mutations driving a tumor. It's like a precision strike hitting only the cancer cells while sparing the healthy ones.
Wow, that's a game changer.
It is.
Are there any other tools in this toolbox we should know about?
Well, hormone therapy can be really effective for certain cancers that rely on hormones for growth, like breast and prostate cancers, like cutting off their fuel supply.
Okay.
Stem cell transplants are another option for blood cancers, replacing damaged bone marrow with healthy stem cells.
That sounds pretty intense. And what about palliative care? I've heard that mentioned in relation to cancer.
Palliative care is essential for improving quality of life for patients at any stage. It's not just about treating the cancer itself, but also addressing the physical, emotional, and spiritual needs of the person going through it.
So it's not an either-or situation.
No.
You can be fighting the cancer while also focusing on quality of life.
Exactly. It's about taking a holistic approach to care, recognizing that well-being encompasses more than just the physical body.
Right.
But, of course, the best medicine is always prevention.
Right. Let's talk about what we can do to reduce our risk in the first place. What are those everyday superpowers? that we can use?
The first one is obvious, but bears repeating. Avoid tobacco.
Okay.
Smoking is like sending a welcome mat to cancer cells.
No surprise there. What else?
You wouldn't believe how much of a difference diet makes. Load up on fruits, vegetables, whole grains. Those are your cancer-fighting superheroes.
Okay.
Limit processed foods, sugary drinks, red meat. Those are the villains in this story.
So it's about nourishing our bodies from the inside out.
Precisely. Regular exercise is another key player on the prevention team. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And don't forget about sun protection. Skin cancer is incredibly common, but largely preventable with sunscreen hats and protective clothing.
Sunscreen hats, sunglasses, the whole 9 yards.
Exactly.
Yeah.
And vaccinations play a crucial role too. We talked about HPV earlier,
Yeah.
but the hepatitis B vaccine can protect against liver cancer as well.
It's amazing how much power we have in our own hands to
Yeah.
prevent cancer. But what about those who get diagnosed? It's
Yeah.
got to be a lot to process emotionally, not just physically.
You're absolutely right. A cancer diagnosis can be overwhelming, but there are so many resources and support systems out there to help you cope and thrive. Counseling support groups, even online communities, can provide a safe space to connect with others who understand what you're going through.
It's that reminder that you're not alone in this journey.
Exactly.
And what about the role of nutrition and exercise? During and after treatment, I imagine maintaining a healthy lifestyle is still important.
It's absolutely crucial. A healthy diet and regular exercise can improve treatment outcomes, boost your energy, and help you feel more empowered throughout the process. And don't underestimate the power of follow-up care. Regular checkups and scans help monitor for any signs of recurrence or complications, so we can intervene quickly if needed.
It's all about staying vigilant.
Exactly. Living with cancer is a journey, and it looks different for everyone. But with the right support knowledge and a proactive mindset, you can navigate this challenge and live a full, meaningful life.
Well said. That was a lot to take in,
It was a lot.
but incredibly insightful. We've only just scratched the surface. But I hope this is giving our listeners a good foundation for understanding cancer.
Indeed, we've covered a lot of ground. The causes, the types, the symptoms, diagnosis, and even touched on treatment and prevention. But there's still so much more to explore.
That's the beauty of the deep dive. We go deep, but we never reach the bottom. There's always more to discover.
Always. And it's amazing how much progress has been made just in the last few years alone. We're moving towards this era of personalized medicine, where treatments are tailored to your unique tumor, like a custom-designed suit of armor.
That's what really blew my mind during the research for this deep dive. It's like we're moving from this one-size-fits-all approach to cancer to a world where we can pinpoint the exact vulnerabilities of each cancer.
Right.
That's got to be giving so much hope to patients.
Absolutely. But it's not just about the high-tech stuff,
Right.
We also need to remember the human side of this. We've touched on the emotional weight of a cancer diagnosis.
Right.
But I think it's worth diving a little deeper into
Yeah.
the support systems that can make a world of difference.
Right, because it's not just the physical battle, it's the mental and emotional one too. Having a strong network
Absolutely.
of family, friends, even online communities can be a lifeline.
Think of it like this. You're on a challenging hike, and your support system is your hiking buddy, offering encouragement, sharing the load, and celebrating those small victories along the way.
I love that analogy. It takes a village, right?
It does.
And it's inspiring to see how many resources are out there to help people cope and thrive throughout their cancer journey. From counseling and support groups to integrative therapies like yoga and meditation, there's a growing recognition that well-being is an integral part of healing.
Couldn't agree more. And speaking of proactive steps,
Yeah.
it's encouraging how much emphasis is being placed on cancer prevention these days.
Right. We have more power than we realize to reduce our risk through those everyday choices that you mentioned.
Exactly. It's empowering to know that we're not just sitting ducks, waiting for something bad to happen. We can actively stack the deck in our favor by making smart choices.
So it's not just about treating cancer when it appears, but creating a body where it's less likely to take root in the first place.
Precisely. And a huge part of that is awareness. You wouldn't believe how many people are still in the dark about simple things they can do to lower their risk. That's why deep dives like this are so important.
Knowledge is power, right?
It is.
And speaking of knowledge, there's one word that always seems to loom large in cancer conversations. And it can be pretty scary, and that word is metastasis.
It's understandable why that word evokes a lot of anxiety, but I think it's important to understand what it actually means
Okay.
without letting fear take over.
So for those who may not be familiar with the term, can you break it down for us?
Imagine a dandelion gone to seed.
Okay.
Metastasis is when cancer cells break away from the original tumor and travel to other parts of the body. Like those dandelion seeds floating on the wind. They can land in distant organs and start new tumors.
That's a vivid image. So it's not just the original tumor that's the problem,
Right.
but also these potential offshoots.
Exactly. And that's why metastasis can make treatment more complex. We have to target cancer cells wherever they may be lurking.
That makes sense. But is metastasis always a bad sign? I mean, we're constantly hearing about new breakthroughs in cancer treatment.
You're right to be hopeful. While metastasis certainly presents challenges, it's not an automatic death sentence. Advancements in treatment are happening all the time. And even in cases of metastasis, we have more tools than ever to manage the disease, improve quality of life, and extend survival.
So it's not a game over situation.
Not at all. There are many factors that influence the course of metastatic cancer, including the type of cancer, the organs affected, and how well the person responds to treatment.
That makes sense. But what determines whether a cancer is likely to metastasize in the first place? Is it just random?
There's an element of chance, for sure,
Right.
but certain cancers are inherently more aggressive, meaning they grow and spread more rapidly. And the stage at which the cancer is detected plays a huge GE role.
So early detection is like cutting off those dandelion seeds before they have a chance to fly away.
Exactly. That's why those regular screenings are so important.
Okay.
The earlier we catch cancer, the better the chances of containing it before it spreads.
Okay, that makes sense from a medical standpoint, but I imagine hearing that your cancer has metastasized can be emotionally devastating. It's like the ground shifts beneath you.
You're absolutely right. It can be a huge blow, both for the person going through it and their loved ones. And it's important to allow yourself to feel those difficult emotions, the fear, the uncertainty, the anger, even grief. Bottling those feelings up won't help anyone.
So where can people turn for support during such a challenging time?
Well, first and foremost, talk to your doctor. They can explain what metastasis means for your specific situation and discuss the treatment options that are available. But don't stop there. Seek out support groups, either in person or online. Connecting with others who have walked a similar path can be incredibly validating and empowering.
It's that reminder that you're not alone.
Exactly.
And what about individual therapy? Could that be helpful?
Absolutely. A therapist can provide a safe space to process those complex emotions and develop coping mechanisms. It's not a sign of weakness. It's about giving yourself the tools to navigate a difficult situation.
Well, it's like having a guide in unfamiliar territory. Now, we've talked about metastasis, but there's another aspect of cancer that often comes with a lot of anxiety, and that's recurrence.
Right.
What does it mean when a cancer comes back? And why does it happen?
Think of it like this. You've weeded your garden,
Okay.
but some stubborn roots remain hidden underground. Recurrence is when cancer cells, even after treatment, manage to survive and eventually start growing again.
So it's like those sneaky cancer cells are playing hide and seek.
That's one way to think about it. Sometimes those cells were there all along, lying dormant. Other times it's a new cancer altogether unrelated to the first.
That must be really frustrating for people who thought they'd beaten cancer.
It's understandable to feel that way. But it's important to remember that recurrence doesn't mean treatment has failed.
Okay.
We have options. And those options are always evolving as research progresses.
So it's not a do-over, it's a new chapter in the story.
Exactly. And a big part of navigating that chapter is understanding why a recurrence happened. Sometimes it's just bad luck. Other times there might be underlying factors we can address, like lifestyle choices or even the type of treatment used initially.
That makes sense. Knowing the why can help guide the next steps.
It can.
But what can people do to reduce their risk of recurrence in the first place?
Well, it's all about creating an environment in the body that's less hospitable to cancer cells. And that starts with those same healthy habits we talked about earlier.
Oh.
Eating balanced diet, staying active, maintaining a healthy weight, avoiding tobacco and excessive alcohol. It may sound simple, but it's incredibly powerful.
It's about taking control of the things you can control.
Exactly.
Yeah.
And sometimes, depending on the type of cancer, doctors might recommend what we call adjuvant therapy after the initial treatment is finished.
So it's like an insurance policy just to be safe.
Exactly.
Yeah.
It might involve chemoradiation, hormone therapy, or a combination. The goal is to mop up any lingering cancer cells those sneaky ones we talked about earlier.
I can see how that would ease some anxiety for people. But what about the emotional side of recurrence? Having cancer come back must be a real blow.
It's natural to feel shocked, scared, even angry. Don't try to suppress those feelings. Talk to someone, a therapist, a support group, a trusted friend or family member. Let those emotions out.
Bottling things up never helps. It's like those feelings need a place to go.
Exactly. And remember, recurrence is not the end of the story. It's a new challenge. But it doesn't erase the progress you've made. There's still hope. There's still options.
Yeah.
And there's still a whole community ready to support you.
Now, throughout this deep dive, you've mentioned genes quite a bit. What's the role of genetics in cancer? And how much control do our genes actually have over our risk?
That's a fascinating area of research that's really exploding right now. We're starting to understand how much our genes influence cancer development, both in terms of what we inherit from our parents and the changes that happen in our cells throughout life.
Okay, let's break that down. First, what do we mean by inherited predispositions? Is that like inheriting a ticking time bomb?
Not exactly. It's more like inheriting a slightly higher risk of developing certain types of cancer.
Okay.
Think of it as a nudge in a certain direction, but not a guarantee.
So it's like some people start the game on a harder difficulty setting.
That's a good analogy. It doesn't mean you'll automatically get cancer,
Yeah.
but it does mean being extra vigilant about prevention and early detection.
And what are some examples of these inherited cancer predisposing genes?
Well, you've probably heard of BRCA1 and BRCA2. Those are linked to breast and ovarian cancer risk,
Right.
but there are many others,
Yeah.
like TP53, which plays a role in cell growth regulation,
Yeah.
and PTNN, which is involved in cell signaling.
So if someone knows they have one of these risk genes, what can they do?
It's a very personalized approach. Some people might choose increased screenings, mammograms more often, colonoscopies earlier.
Right.
Others might consider prophylactic surgery to remove the tissue at risk, like Angelina Jolie famously did with her breasts and ovaries.
That's a big decision.
Yeah.
But it highlights how knowing your genetic risks can empower you to take proactive steps.
Absolutely. It's about weighing the options and making informed choices that align with your individual values and risk tolerance. But remember, genetic testing is just a tool. It provides information, not a crystal ball.
Right, it's not a destiny, it's a roadmap.
Exactly. Now, on the flip side, we have what are called acquired mutations,
Okay.
changes in our DNA that happen throughout life. These aren't inherited, they develop over time due to things like exposure to carcinogens or errors in DNA replication.
So it's like our cells are constantly being bombarded by these potential mutating forces.
In a way, yes. Our cells have incredible repair mechanisms, but sometimes those typos slip through the cracks.
And if one of those typos happens in a critical gene, it can lead to cancer.
That's right. Imagine those genes as the instruction manual for how cells are supposed to behave. If the instructions get corrupted, the cells can start going haywire.
So it's this combination of inherited and acquired mutations that sets the stage for cancer.
Exactly. And the more we understand about this intricate dance of genes, the better we can tailor treatment and prevention strategies. But here's where it gets really interesting.
Okay.
Every tumor has its own unique set of acquired mutations.
So even though two people might have the same type of cancer, their tumors could have totally different genetic profiles.
Precisely. That's why we're seeing this shift towards personalized medicine. Instead of using a generic weapon, we're analyzing the genetic makeup of each tumor and designing treatments that target those specific vulnerabilities.
It's like a custom-made cancer-killing cocktail.
That's a great way to put it. And it's an area that's constantly evolving as we learn more about the genetic drivers of cancer.
That's encouraging, but I imagine all this cutting-edge research relies heavily on clinical trials.
You're absolutely right. Clinical trials are the backbone of progress in cancer research. They're how we move those promising new treatments from the lab to real-world patients.
Okay, for those who may not be familiar, what exactly are clinical trials?
Think of them as carefully designed experiments that test new drugs, therapies, or medical devices in humans. They're essential for determining whether a new treatment is safe, effective, and better than what we currently have.
So it's like a real-world testing ground for the next generation of cancer treatments.
Exactly. And they involve real people, real patients who are willing to contribute to scientific advancement.
I'm intrigued. How do these trials actually work?
Well, they go through several phases, each with a specific purpose.
Okay.
Phase 1 trials are like dipping a toe in the water, focusing primarily on safety and figuring out the right dose of a new treatment.
So it's all about making sure it's not going to cause more harm than good.
Exactly. If it passes that test, it moves on to phase 2, where we recruit more people and start looking closely at effectiveness. Does this treatment actually work against the cancer?
So it's like we're testing the weapon's accuracy.
That's a good analogy. And if it hits the mark in phase 2, it graduates to phase 3, the big leagues.
Okay, what happens in phase 3?
Phase 3 is where we bring in hundreds, even thousands of patients and compare the new treatment to the current gold standard. It's a head-to-head battle to see which one comes out on top in terms of effectiveness, safety, and long-term outcomes.
So it's like the championship game?
Exactly. And if the new treatment proves to be superior, it may eventually get approved by regulatory agencies like the FDA, making it available to the public.
That's the ultimate goal, right?
It is.
Getting those life-saving treatments to the people who need them. But I imagine participating in a clinical trial can be a big decision. What are some things people should consider if they're thinking about enrolling?
It's a personal decision that shouldn't be taken lightly. There are potential benefits, like access to cutting-edge treatments that aren't available yet to the general public. You're essentially getting a sneak peek at the future of cancer care.
So it's like being on the front lines of medical innovation.
Exactly. But it's crucial to be aware of the risks, too.
Okay.
New treatments are unproven, meaning there's a chance they might not be effective or could even have unexpected side effects.
So it's a calculated risk.
Exactly. That's why open communication with your doctor and the research team is essential. Ask questions, understand the potential benefits and risks, and make sure you feel comfortable with the level of uncertainty involved.
It's about being an informed and empowered patient.
Absolutely.
No, we've covered a lot of scientific ground.
We have.
But I want to shift gears a bit and talk about the human experience of cancer. It's not just about cells and genes. It's about people's lives.
You're absolutely right. We can't forget the emotional, social, and spiritual dimensions of this journey. A cancer diagnosis can shake your world to its core, impacting not just the individual, but also their families, their communities, their entire sense of self.
It ripples outward like throwing a stone into a pond, and everyone experiences those ripples differently, right?
Absolutely. There's no one-size-fits-all emotional response to cancer. Some people ride a roller coaster of emotions: shock, disbelief, fear, sadness, anger. Others might find themselves surprisingly resilient, drawing strength from their loved ones, their faith, or their own inner fortitude.
It's like each person finds their own path through the storm.
That's a beautiful way to put it. And there's no right or wrong way to cope. The key is to allow yourself to feel whatever comes up. And to seek support when you need it. Don't try to be the strong one all the time. It's okay to lean on others.
So where can people turn for that kind of support, that sense of connection?
Support groups can be incredibly powerful. They create a safe space to share your experiences, learn from others who are going through similar challenges, and realize you're not alone in this fight. There are also online communities and forums, which can be especially helpful for people who might feel isolated or prefer to connect anonymously.
It's amazing how technology can bridge those gaps and create a sense of community.
It can.
And what about individual therapy? Could that be helpful for processing the emotional upheaval of a cancer diagnosis?
Absolutely. A therapist can provide a non-judgmental space to explore your feelings, develop coping mechanisms, and address any mental health concerns that might arise, like anxiety or depression. Remember, taking care of your mental health is just as important as taking care of your physical health.
It's about recognizing that you're a whole person, not just a body with cancer.
Exactly.
And for many people, their spirituality plays a big role in coping with difficult times.
Absolutely. Whether it's through prayer, meditation, spending time in nature, or connecting with a religious community, spirituality can offer a sense of peace, purpose, and connection to something greater than oneself. It can be incredibly grounding during times of uncertainty.
It's about finding those sources of strength and meaning that resonate with you.
It is.
But there's another side to this human experience that we often shy away from, and that's death and dying.
It's a difficult topic for sure. But death is a natural part of life. And facing a life-limiting illness like cancer often brings these conversations to the forefront. It's not about dwelling on death, but about acknowledging its presence and making choices that align with your values and wishes.
So how can we support people who are grappling with these end-of-life issues?
The most important thing is to create a space for open and honest communication. Listen without judgment, offer comfort and support, and be present with them in their grief. Don't shy away from difficult conversations. Sometimes just being there is enough.
It's about being a compassionate presence, a
Yeah.
witness to their experience. And what about the practical side of things? Are there things people can do to ensure their wishes are honored?
That's where advanced care planning comes in. It's about having conversations with your loved ones and healthcare providers
Yeah.
about your values,
Yeah.
your goals,
Yeah.
and your preferences for medical care, especially if you're unable to speak for yourself.
So it's like writing the last chapter of your story while you still have a voice.
Exactly. It's about taking control of your end-of-life journey and ensuring that your wishes are respected, even if you're no longer able to communicate them directly.
That must bring a lot of peace of mind, both for the person and their family.
It can.
Now, there's one final piece of this human experience puzzle that we haven't touched on yet, and that's the financial burden of cancer.
Right.
It's like this added layer of stress on top of everything else.
It's a harsh reality, for sure.
Yeah.
The cost associated with cancer treatment can be staggering. Doctor's appointments, hospital stays, medications, surgeries, ongoing therapies, it all adds up quickly.
It's like this financial monster lurking in the shadows. What can people do to protect themselves, to navigate this financial maze?
Well, the first step is understanding your health insurance coverage.
Okay.
What's covered, what's not.
Great.
Your copays, deductibles, all that fine print. Don't be afraid to ask questions and advocate for yourself.
It's about being informed and knowing what you're dealing with.
Exactly. And if you're facing financial hardship, don't suffer in silence. Many hospitals and cancer centers have financial assistance programs or can work with you on payment plans.
So it's worth asking about those options.
Absolutely. And there are nonprofit organizations that provide financial assistance to cancer patients and their families. You're not alone in this. There are resources available if you know where to look.
So it's not about surrendering to the financial burden. It's about being resourceful and seeking out support.
Exactly. Remember, taking care of your financial health is just as important as taking care of your physical and emotional health. During a cancer journey, it's all connected.
And speaking of connections, I want to bring us back to something you mentioned earlier, the importance of research.
Ah, yes. Research is the engine that drives progress
Yeah,
in the fight against cancer.
exactly.
It's the fuel that powers new discoveries,
Yeah.
new treatments, and ultimately new hope.
We've come so far in our understanding of cancer, thanks to decades of dedicated research. But the journey is far from over, right?
Absolutely. Cancer is a complex and ever-evolving adversary, and there's still so much we don't know.
So where is research focused right now? What are the areas that are generating the most excitement?
Well, immunotherapy is a big one. It's like teaching your body's own immune system to be a cancer-fighting ninja.
We talked about that earlier. It seems incredibly promising. But are there challenges?
There are. Not everyone responds to immunotherapy, and we're still figuring out who benefits the most and how to minimize side effects, but there are breakthroughs happening all the time.
So it's a work in progress.
Yeah.
But a very hopeful one.
Absolutely. Another hot area is targeted therapy, those custom-designed weapons we discussed earlier.
Right.
As we uncover more genetic vulnerabilities in cancer cells, we can develop drugs that exploit those weaknesses with laser-like precision.
So it's all about precision medicine, tailoring treatments to the individual's unique cancer.
Exactly. And then there's nanotechnology, which is like science fiction becoming reality.
Nanotechnology. Tell me more.
Imagine tiny robots, smaller than a human hair, delivering drugs directly to...
That's a really good point. Survivorship isn't just about physical healing, but it's about reclaiming your life.
It is.
And finding your new normal.
Exactly. And that new normal might look different for everyone. Some people find that cancer gives them a new perspective on life, a newfound appreciation for the simple things. They might make major changes, pursuing passions they put on hold, or prioritizing relationships.
It's like that saying, you know, what doesn't kill you makes you stronger. But I imagine there are also times when it feels anything but strong.
Of course. There will be good days and bad days.
Right.
Some days you might feel like you're back to your old self, full of energy and optimism. Other days you might be exhausted, overwhelmed, and scared that the cancer will come back.
This roller coaster, isn't it?
It can be. And that's why having a solid support system is so crucial. Don't be afraid to reach out to loved ones, therapists, support groups, online communities, talking about your feelings, connecting with others who understand, and seeking professional guidance can make a world of difference.
It's about giving yourself permission to be vulnerable, to ask for help when you need it.
Absolutely.
We've talked about resources for people during treatment, but are there specific resources for survivors?
Absolutely. Many hospitals and cancer centers offer survivorship programs. that provide education, support groups, and guidance on navigating life after cancer.
Okay.
They can help you address physical side effects, emotional challenges, financial concerns, and even practical things like returning to work.
It's like a toolbox for rebuilding your life.
Yeah.
And there are also national organizations that offer
Yes.
wealth of resources, right?
There are organizations like the American Cancer Society, the National Cancer Institute, and the Leukemia and Lymphoma Society provide information support and advocacy for cancer survivors and their families.
So much of what we've talked about today comes down to being informed and proactive, whether it's about prevention, treatment, or survivorship.
I couldn't agree more. Knowledge is power, especially when it comes to something as complex as cancer.
Well, we certainly packed a lot of knowledge into this deep dive. But as always, there's so much more to explore.
There is. The world of cancer research is constantly evolving, with new discoveries and breakthroughs happening all the time. It's a dynamic and hopeful field.
And that's what I want to leave our listeners with, a sense of hope. Cancer is a formidable opponent, but it's not unbeatable.
Exactly. We have more tools than ever before to prevent, detect, and treat cancer. And perhaps even more importantly, we have a growing understanding of the human experience of cancer, the emotional and social dimensions that are so crucial to healing and thriving.
So as we wrap up this deep dive, what's your call to action for our listeners? What can they do individually and collectively to make a difference in the fight against cancer?
First and foremost, talk about cancer. Break the silence. Share what you've learned from this deep dive with your family and friends. The more we talk about cancer, the less stigma there will be, and the more likely people are to seek help when they need it.
It's about creating a culture of awareness and support.
Exactly. And support cancer research. Donate to organizations that are funding cutting-edge science and working to develop new and more effective treatments. Every contribution, no matter how small, helps fuel progress.
Every dollar is a vote for a future without cancer.
That's a powerful way to put it. And advocate for policies that promote cancer prevention and early detection. Make sure everyone has access to affordable health care and quality cancer care, regardless of their income or background.
It's about creating a society where everyone has a fighting chance. And remember, even though cancer is a serious disease, it doesn't have to define you. There is life beyond cancer, a life filled with hope, meaning, and purpose.
Beautifully said. Keep learning, keep advocating, and keep believing in the power of human resilience. Together, we can make a difference.
This has been an incredibly informative and inspiring deep dive. Thank you for joining us on this journey.
It's been a pleasure sharing this space with you.
Until next time, stay curious, stay informed, and stay well.